that DAR snippet was really interesting. Now I have some home health service personnel. Nancy and Kathy, welcome this morning. It's nice to have you with us.
Well, it's wonderful to be back. Thank you.
Now,
Morning,
prior to the camera coming on, you said you're going to come up with an update,
Yes, sir.
and Kathy's going to give us an update on hospice.
That's correct.
So, with that background, take over.
Have at it. All right. Well, I'd first like to let the community know that a brand new Ancillary Health Services Committee has been formed as a part of the Resident Council. So,
Ancillary Health Service
Committee. And it's a brand new committee that has a number of residents, about 6 or 7 residents. Jenny King is our lead, Carolyn Posey is our liaison, and we're going to be focusing with the committee members on how to educate residents in the community about the availability of the ancillary services such as hospice, such as certified home health, such as the private duty agency, and how to access these services. So we're going to really focus on community education for these services. And so we had our first ever meeting on January, the first week of January, and the next meeting in February, we will meet monthly. We're going to be focusing on hospice. We're going to take one program at a time and get the word spread about what the service does and what the benefits are to the residents.
So Kathy will be chairing the first meeting?
Kathy will be joining me.
Or joining you? Okay.
Yes. So I am a worker bee I represent the agency on the committee. And so what we decided in our first meeting was that as we take one program at a time, that I will bring the clinical manager of that agency with me so that she can be involved in whatever it is that our plan that we come up.
How many programs do you oversee in your office? Hospice is one.
Yes, I oversee
What's another?
the hospice, certified home health,
Home health.
and Green Spring Home Support, which is the private duty agency.
These outlooks that you have under you, if you will, are manned, quote unquote, by registered nurses and et al.
Oh, yes. So the two Medicare certified agencies are, hospice is a Medicare certified agency, and the home health agency is Medicare certified. They're very distinct in the services that they provide, but they're a registered nurse is the clinical manager and oversees the clinical operation. And we have registered in hospice, we have registered nurses, social workers, volunteers, home health, just a number of personnel who come together to deliver end-of-life services to residents. Certified home health is more of the home health rehab focus.
Since this is it is a brand new outlook out of your office, will you be at the end of each committee meeting publishing the results of your studies or your conversations or whatever?
So Carolyn Posey is our liaison to the council, the resident council, and she will be sharing that information with the resident council, which then goes through the process to go to the...
So we will not see something specifically coming out of your office, but we will see it included within the minutes, if you will,
Yes.
of the overall council.
Yes, sir, that's my understanding.
Okay.
Yes.
So we've cleared that up.
Yes.
And you said there's 7 people or so on your, 7 residents on your committee?
Yes, sir. Yes, sir. Brand new. So the good news is we don't have to follow anybody's footsteps. We can set our own mission and make no mistakes.
You make your own footsteps.
That's right. That's right.
So what other things do you have coming up in home health?
Well, in home health, I wanted to let the community know that, now, again, this is a Medicare certified agency that provides home health to residents in their home based on medical necessity signed by the physician, and the resident needs to be limited in his or her ability to get out and about by the illness, and that's called homebound status. And those services are services of a registered nurse, maybe a physical therapy, an occupational therapy, a speech therapist, or a home health aide to help the resident get back to good health and do the personal care. So that's certified, and we took care of 324 residents. We delivered service in 2015
Really?
to 324 residents, yes.
You keep mentioning this word Medicare. Are you monitored by Medicare personnel?
Oh, yes.
When I say you, your office.
Yes, the work that we do is monitored through the claim process. So the claims that we submit to Medicare, there's a tremendous amount of detail on those claims, and Medicare scrubs and data mines those claims to pull off all the information they can possibly squeeze off of it. And yes, they monitor. Both of the Medicare agencies are heavily monitored.
Kathy, you're the guru of hospice, so to speak. For the benefit of our new residents who may not know of your facility, explain to us just where you fit into this big home health jigsaw puzzle.
We are one of the 3 agencies that Nancy mentioned, and our continuum of care is at end of life. So all the services that we provide are for residents and their families who their loved one is at end of life. And it could be from heart disease, dementia, cancers. And our focus is how can we give our patients quality of life for whatever remaining days they have. And then also teach our families how to provide care. We empower our families to provide care to their loved ones so they get the most out of those final moments that they have.
What training did you undergo to become qualified as a hospice supporter?
Well, actually, it was a lot of on-the-job training. And then at one point, I did go and sit for my certification. So at one point,
Do you have to be certified by Medicare?
No, you do not have to be certified. It's just an extra credentialing to
really?
show that you are, very knowledgeable in how to take care of residents at end of life.
At this very moment, how many clients or patients do you have that you visit, you or whoever is working with you?
Oh, we have
2 or
about,
3?
well, on a daily basis, each nurse could see upwards 6, 7 patients, depending on what the needs are.
So, what really do you do when you sit down with a patient or with the family?
What our focus is quality of life. How can we take any symptoms of their disease and get them under control, whether it's pain, anxiety, and the nurses medically manage medications and treatments to get those symptoms under control. And then my other team members, the social worker, the chaplain, they provide the emotional support, the spiritual support, because when we're dying and going through that process, it's not just a medical process, it's emotional. It hits our heartstrings. So we have to help the patient and the family come to a level of acceptance that this is going to happen, help them understand how to take care of their loved one and prepare for that dying process.
Then you and your other 2, hands-on?
Very much so. Everybody on the team is very hands-on. I will go out also and do evals, I will do admissions, I will go with my team members to take a look at patient issues and try to bring different perspectives to the table for the plan of care.
There's a young lady that's in your office, an Ethiopian lady named Ziggy.
Siggy.
Does she work in the hospice area?
Yes, sir. She is one of our home health aides.
And the reason I ask is because, under personal experience, my dear wife was attended to by, among others, Ziggy, who would come over to the apartment and wash her hair or fix her hair, do something. And it seemed to me that when your home health personnel left, and I'm including the Jane, the nurse, and even the doctor, it seemed like Emily was uplifted just by somebody washing her hair or fixing her hair or whatever it was. And I was most appreciative. And everybody who walked into my apartment had a smile, a positive outlook that I really appreciated seeing. And so I tip my hat to all of the home health personnel. Do we have any more updates today that we want to pass on, or are we?
I just have one little update from the home support, the private duty agency, that in December we provided 19,000 hours of aid service to the Green Spring residents.
19,000 hours?
Yes,
oh
sir.
Oh my gosh.
That's the highest ever for the Green Spring Home Support, and the Home Support Agency is the second largest in all of the Erickson world. So we're right.
Really?
Yes, sir. Yes, sir. So,
Wow.
you know, that's wonderful. Our aides are dedicated to providing great service to the residents, and
Oh, I
so
do have
we're-
another question.
Mhm.
Does a representative from Medicare visit your office?
Mhm.
They do.
Yes, sir. We had a visit in the hospice agency the beginning of this year,
January 15.
January 2015, and we were found to have no deficiencies. It was a 100% perfect survey.
Let's say that again.
In January, it was wonderful. In January 2015, the hospice was surveyed by, it was a federal survey and a state licensure survey, and the surveyor found 0 deficiencies in the hospice. The prior year, we had the pleasure of having a state survey, which represents Medicare, in the Certified Home Health Agency, and we were found to have 1 technical deficiency, totally unrelated to patient care. So that was quite an accomplishment.
That tells me that you are professional all the way. When I say you, I'm referring to your office.
Absolutely, it's all
Not-
of us.
Not just one person.
Absolutely.
That is outstanding. Well, we have just about run out of time, I'm sad to say. I would like to thank you ever so much for coming here, Nancy and Kathy, and I wish you a very healthy and happy New Year.
Thank you, Bob, and the same to you and
Thank
all of the
you, my dear.
residents.
Well, I have some announcements that I would like to pass on.